Hi, my friends. Welcome to OSCE with Ghazal. Um, Thanks for waiting and sorry about the delay. I was just planning to make an exciting video that is a boost start when you are thinking to prepare for OSCE. These will not only help you while you are preparing for your exam, also will help you during your exam day, like how to combat. So I decided to make this video first, and then we will post some cases and how to solve that, like one by one. But basically, before going for the cases, this video is very helpful as it will tell you some tips and tricks that you can accumulate in your practice and pass your OSCE with the flying colors, right? Okay, so what I'm going to cover today, introduction about the exam itself, just a quick intro. I know you guys are already aware. Some tips that you can use to cope with anxiety and some tips to follow before exam so you can succeed, right? Oh, sorry about that. So what is OSCE basically? So you are going to perform in simultaneous environment. Assessor will assess you. So basically it's the last exam of PEBC. Some people can do it as a second last as well, but once you pass your document evaluation and you are okay to go for evaluating exam, and then there is a qualifying exam that's divided into two parts. um, what you call is the MCQs, that's your clinical knowledge, and then OSCE. So when you go on in OSCE, they will just test you. There are different stations, almost 13 stations. Some are interactive, some are non-interactive stations. In interactive station, you will see a person. Sometimes there is a one assessor, sometimes there are two. They are there, and one person is coming as a patient, can be some healthcare provider, or they will ask you a question, or they will come with some concern, and then you have to solve the cases with flying color. Sometimes it's not like possible, or time is very less, or you cannot complete the case. But as far as you are not putting patient at risk, I would say that's a good to go. So always try to solve the case first thing. Even if you can't, just don't give any advice that you are not sure of. Okay, so how to cope with anxiety, exam anxiety. Every exam, no matter what kind it is, there is anxiety, right? So that's very hard question, but answer is very simple. Make sure that you are following the exam updates, because of the COVID especially, they keep on changing it. So stay up to date, stay connected with the social media page, or especially the PEBC web page, and keep regularly check your um, emails, because that's the point where anxiety is getting a lot, when you don't know the updates and you are like, oh, all of a sudden where does it comes from, right? So other thing is exam procedure. Know your procedure really well. Like, there are interactive cases, there are non-interactive cases. In interactive cases, what are the types? Like counseling on the drug, sometimes there is a drug therapy problem, sometimes there is just OTC recommendation. So you know the procedure, then you know the steps to solve it. Stay connected. So with your fellows, friends, or the web page, stay connected. Again, email, social media, so that will not pop up your anxiety at 11th hour. Now, I will start covering some important tips for exams that will you that you can start using during your day-to-day practice of your OSCE with your friends, family member. Even if you don't remember, try to accommodate that. So first one is anxiety. How to cope with it. First things that's easy to set, then it's done, right? Is don't let your anxiety appear on your face. Um, I would say nowadays it will be easy because masks are mandatory because the problem occurs when you everyone is anxious. I would not say that don't be anxious. That's not practical. I would say just try to cope your anxiety or with a little bit of smile on the face whenever appropriate, or just to show the show that you are not anxious. Stay confident, your voice should not be fluttering, and that's all, right? Time management. So time management is another important factor or tips when you are in OSCE. So OSCE is all about time. They will give you like 7 minutes to solve, 2 minutes to decide, 2 minutes to make your point. So whenever you are practicing during for OSCE, set your timer. That's very important. If you can work on time management, then your anxiety will be less. Anxiety can also pop up when you are not managing your time well. So we will go on this in our next lecture, but I would say divide it. Like for patient interview, I will take 2 minutes. For counseling, I will take 3 minutes, and for these questions, I will take this minute. So divide it, right? And make your question really quick but informative, right? Whenever you ask questions, so patient gives you complete interview. Complete answer is very important because that's where the problem can be, right? Another tip. Practice, practice, and just practice. I would say practice with your friends, colleagues, practice with your family members. That's the only key to success. When I was preparing for my exam, I prepared with my husband. Sometimes he was a patient, sometimes my son was a patient. Throughout the day, just do some cases and practice as much as you can and different cases. Makes your notes, makes your steps to follow. Okay, let's go to next step. It is very important to record yourself. Whenever you are recording yourself and listening again, you will find your mistake and you will try to practice and avoid them in future. When you hear them again, then you find some mistake. Where to work on, is your voice too fast, too slow, too loud? Whatever your points are, when you listen to yourself, listen your recording, then you will be easily work on the points that should be work on, right? So always record yourself while practicing daily. Next tip, I would just say most important is to familiarize yourself with types of cases. If you know the type of cases, then you will stay confident, right? You will say like it's counseling case or there is a drug therapy problem, there can be a drug therapy problem. This thing can again be solved with the practice. So familiarize like what are the interactive cases, what kinds of non-interactive cases you can get, right? Like calculation or some dose calculation, some maybe problem with the technician, and there can be a management case as well that you can how you will solve this problem or that during your practice as a pharmacist. So just stay aware with that as well. No doubt you have to familiarize yourself with the type of cases, but also familiarize yourself with different types of reference and how you can use it. Sometimes the reference can be like 10 pages. How, and you don't have enough time during that, so you must know where exactly you will find that information. In my next videos, like in upcoming videos, I will also go over how to exactly look where your information is, but familiarize yourself sometime and where to go and dig for the information. Sometime they can give you the drug monograph. Sometime they will give you the leaflet. Sometime they will give you the some news material online. Sometime it can be a research study. So you should know where the answer can be, because you also have to communicate with patient rather than just looking here and there in your reference material. The next step is the steps to follow. So during practice, make steps that you will follow during your case solving, especially with interactive cases. So when you're practicing, make your steps or made your procedure, like I will start with interviewing first, what my question will be in interview. The next slide is coming with the patient interview. What will be my interview question? What will be my counseling points? So make your steps to follow, and when they give you few minutes before starting the case, just write the short forms. I will go over with that in next slides, but acronym making will help in that. So I will guide you how to do that. This is all from my side for today. Do leave in a comment what you want me to do in the next video, what you want to cover, what type of the cases. I will be solving some cases for you, but slowly and gradually I will be posting some videos. But do update, do like my page, subscribe for more videos, and let me know what we can work on together. I will definitely posting videos every week or so, so you guys can, but your comments, like and subscribe will help me deciding what we can do next. Thank you guys. See you later. Bye.